The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, I'm Dr Amna and welcome to the Health and Fitness Show on Inspire FM. The time is 6 p.m. It is Thursday, the 22nd of June 2023, and for the next hour we'll be focusing on your health and fitness. So today is another very special show. I feel like we're doing lots of kind of special shows recently, where we are pre-recording ahead of a Bedfordshire, Luton and Milton Keynes event that is happening next Wednesday on the 28th of June 2023, and we'll be telling you all about that shortly. So you're either listening to us on 105.1 FM, but we will also be live on the Inspire FM YouTube page, the Inspire FM app and Facebook Live if you want to go back and have a listen again, as well as linking towards our social media on Instagram, on Twitter and on my Instagram at Dr. Amna GP. So please do get in touch with any questions. If you want to send in any questions or comments, especially about the event that's coming up next week, please do call us on 01582 481 822 or send all your questions via text or WhatsApp on 0777 948 1822. That also includes any questions that you want to put forward to the event, and the event is going to be around pre-conception. Now, pre-conception care, we're going to find out from Dr. Sanhita, who is joining me today, is all about thinking about and preparing for having a baby. And it might be that you're thinking, well, surely you think about having a baby and then you try and have a baby and then you have a baby. And for some people, yes, it is that easy, but actually, are they then getting the most out of their health? And here on the Health and Fitness Show, we want to talk about things and make you think about things to optimize your health at every point. And pregnancy is such a huge part of all of our lives, that it's really important that we make sure that we are pre-planning as well as possible. So today, as I've said, I am very lucky to be joined by somebody with a lot of experience in this field. So it's Dr. Sanhita Chakrabarti, who has been on the Health and Fitness Show many times before. With Fahad, you may have heard her speak before. She is a consultant with an interest in improving the lives of women and children, and she's also the Deputy Medical Director for the Bedfordshire, Luton and Milton Keynes Integrated Care Board. So she's really involved in what kind of decisions and programs happen across the whole area of Bedfordshire, Luton and Milton Keynes. So I'm really happy that you've managed to find a little bit of time to speak to us today. Thank you for joining us.
Thank you, Amna, and assalamu alaikum to all the viewers today. And I'm really delighted to come and talk to you today about a very important area, which is about getting ourselves ready to be parents. And I think we are going to have an exciting show.
Yes, definitely. So this, as I said, this is ahead of an event that is happening next week. So correct me about the details if I'm wrong. So it's Wednesday, the 28th of June from 7 to 8:30. It will be a virtual event on MS Teams, and it's open to anyone across Bedfordshire, Luton, Milton Keynes to freely join. The links will all be on linked to all the Inspire FM information about today's show. It will also be on Twitter, on Instagram. Please do link in. We want to be able to listen to women, anyone who is contemplating pregnancy, thinking about pregnancy. There'll be a panel of experts, but Sanhita can tell us a little bit more about that event, please.
Yes, thank you, Amna. So on the 28th, we want to hear from women, parents, couples who are contemplating in becoming a family, contemplating in starting a life with a little one, that we can talk as partners and understand the challenges, because it's important for us, as we will hear and we will discuss together with Amna, about the fact that We plan a whole lot of things in our lives, but pregnancy sometimes happens for us quite instantaneously, and absolutely the right thing to do. But what we want to talk to you about is the help and support and the resources that we could access ahead of planning a pregnancy, which will give us that additional edge, that additional advantage of getting into parenthood in a healthy state of body and mind. And that is what our intention is. On the 28th, it's a virtual event. We will have a panel of experts delivering some content, but we want to hear from you. We want to hear from you, your anxieties, your just come with your questions, your inquisitiveness, and we want to develop sort of with you sort of a partnership kind of conversation, and so that you can take it away into the communities to start to think about how we can get the safe pregnancy message out there. Our program of work is called Healthy Mothers, Healthy Pregnancy, and we want to talk to communities and get this message there. 28th of June is yet another of these events, and it'll be more focused on particularly communities from diverse sort of diverse heritage. So communities from Black, African, Caribbean, Asian heritage. We particularly want to invite you to come and join us because we acknowledge that there is a lot more work that we can do together.
Thank you. That's a really good summary, and maybe that's a good place to start in terms of there are some differences, and I think on the shows that I do, definitely we talk about a lot that we need to be having conversations that we don't normally have these conversations about, things that, as you said at the beginning, might just seem like, oh, it's a normal part of life. Somebody gets married, the expectation within some communities, certainly, my Arab community, Asian communities, you're going to get pregnant straight away and that's it, and you're going to know what to do, and everyone across the world gets pregnant, all of the time, and it just happens. But actually it's a lot more complicated than that. There's a lot more that we maybe need to be considering or talking about, and pre the show even we were kind of just discussing not just the physical health, because I think that may be something that is talked about a little bit, make sure you're eating well, but what is eating well? I think we talk about that a lot, and a few months ago we had Dr. Kathari from Butte House Surgery talking about actually what does it mean to eat well, what changes can you make, and anyone who missed that show, I'm going to link that as well to this show, because I think it's really important. But also kind of mentally, are you mentally prepared for thinking about a pregnancy, but also what are you going to do during the pregnancy? And then life after. So what are your thoughts on that?
And you're absolutely right. And when you put your Amna, links in, I will send you a link that Tommy's, which is a national charity who look after women, and they do a lot of research around on pregnant mums. And we are partnering with Tommy's, and it's quite interesting. I'll send you a YouTube video. So they did a survey, they did a random survey. So they just interviewed women on the streets of London, and they asked them a couple of questions. And one of them is, so when you go on a holiday, what do you plan? How do you plan your holiday? And a lot of planning goes into our holidays, isn't it? We kind of think we've got to take leave, we've got to organize the kids.
A year in advance.
A year in advance.
I speak to people who are like, oh yes, my next holiday, next summer, I'm going to go to Florida, and I've been looking at this and this and this and this. Yeah.
And then you research where you want to go. And then, of course, you buy your clothes, and, you buy your tickets in advance. You research where it's the best deals. You talk to friends who've gone, and you do all of that research. And so interestingly, and then the next question they asked is, and so what do you do? What do you plan for when you want to have a baby?
Wow.
And most women went, find a man. Not sure. Does it not happen normally? And it's quite interesting. So,
That's a really interesting way of thinking about things.
Yeah. I'll send you the YouTube link, and then you'll see why that survey was so poignant. So Tommy's, and the reason I'm mentioning it, so Tommy's preconception tool, it's freely available. Again, I'll send you the link, and that's what we're going to talk about on the 28th of June. Tommy's is one of our main partners, and Amna Hawash is their lead midwife, who's going to lead the conversations on that day. And so Tommy's have developed this tool, which basically is your self-assessment tool. Now, any woman, any parent can do it at any time. And I'm just saying parents, because, men are part of sort of being pregnant, but also, we've got families where, of sort of, single parents, adopted parents, any kind of parenting. Just, the preconception tool helps you to understand and do a self-assessment for yourself. Where are you and what help do you need? So it helps you to understand, are you in the right weight? Is your mental well-being in the best place? Are there other things? And then it kind of gives you a bit of
it's not just about the woman, is it? It's actually, do you have children before? What will the impact be on them? Finances, who is, bringing finances to your home? What's your home like? All of these things, actually. And okay, so that's really good. So anyone can use this tool, so anyone listening.
So so anybody. And the thing is, what we're encouraging is more women to use it. And then once you use it, it takes you to a page and it gives you some advice, and then it keeps giving you, because you put your details in, and then it keeps giving you prompts to say, and have you checked in on this? Have you checked in on your diet, or whatever it is, or your weight? Have you talked to your GP? Have you got advice? Have you got support? So so they've developed the tool, and because of some of the research work they've done in these surveys, and it's pretty interesting. Why is it important for us in Bedfordshire, Luton, Milton Keynes? I'm a senior clinician, and I lead on maternity, maternal health, and also child health. What we are seeing a lot is quite poor outcomes in pregnancies, and also children who are then suffering. And when we actually go back and look into it, there is a whole lot of issues that, mothers had complicated pregnancies, they had, other conditions like diabetes. That would be some of the causes. But many a times, if we go that one step back, and because we talk to parents and we start to understand, did we actually have the mums ready before they were pregnant? So yes, you could have a condition like, I've got high blood pressure, or I had anxiety, our current lives are so stressful, anxiety, the stresses, the normal stresses and strains of our modern life. We've got the cost of living crisis. Look around the world. You open the news, it's depressing. All of that affects us. Are we happy in body and mind before we actually get into pregnancy? And many a times we're seeing that there was a lost or a missed opportunity for us. If we had an opportunity for our women who were carrying the pregnancies to have that assessment before they became pregnant, or have that kind of chat with their clinician, their GP, their midwife. Well, not so much their midwife, because your midwife comes in only when you're pregnant. It's your GP mostly, but there are lots of other people who can support you ahead of saying, right, I have these things happening in me. Am I now ready? And what can I do to get ready to be pregnant? We could have had some better outcomes. So this is why in Bedfordshire, Luton, Milton Keynes, I've launched this program, and I'm lead for this program. And it's called Healthy Mothers, Healthy Pregnancy. It's going to be a year-long program of conversations and lots of support out there. So the preconception tool is one, and it's freely available. We're working with Diabetes UK, because it's quite significant number of mums, particularly if you're from diverse communities, have come from families with familial diabetes, either have type 1 or type 2 diabetes, or have had a pregnancy where they've had gestational diabetes. Now, those mums need to come into their next pregnancy or get into pregnancy quite prepared. But many a times, and our statistics show, very few mums come into pregnancy prepared. So their blood sugars are not ready, and their hypertension, their blood pressures are not controlled. So with Diabetes UK, we
picked up kind of at the, as you say, when the midwife picks you up when you're already pregnant, and then picks up, okay, well, what's your family history? What's all of this? But actually, if we knew you were maybe at risk before, but how many people listening to this show have had that conversation, you know, pre getting pregnant? And I think, you know, for me as a GP, I do not have these conversations on a regular basis. You know, people do not book in to see me to say, well, I'm thinking about having a baby. I think we have a lot of conversations about, I want to not have a baby. I want to be on contraception. How can you help me? And, you know, we've talked previously about contraception and different options, and great, if you're not ready to have a baby and you don't want to have a baby, then fine. But I actually don't see people in the middle who are then saying, okay, well, I'm thinking about having a baby. What tends to happen is they at some point stop their contraception, they get pregnant, and then they're picked up with the midwife. So actually they don't see their GP. And I think when we've been talking about this program and why I think it's really, really great that Sanhita set this up to allow these conversations to happen, is just to have an awareness that you are able to have these conversations. These conversations should be happening. There are things that we can do and prepare you to put you in the best possible position, like you said, with the with planning for going on holiday, for example. But for me, we've talked a lot this last year or so since we've done the marathon, and we've had lots of people coming in talking about how to do that and how to pre-plan. And you're not going to wake up one day and just be able to do a marathon, but actually you're going to think, what's the first step? You know, thinking about it, what do I need to change in my life? What things, is it safe for me to be able to you know, plan to run a marathon? And I think that's exactly what you're saying. You know, if I know that my sister, my mum, my auntie, everyone had diabetes in pregnancy, or that, you know I'm very overweight. I think the thing that is mostly talked about, I don't know if you would agree, and so it should, obviously, smoking. I think that's the one thing that I think people think about or talk about or consider to give up pre getting pregnant or pre thinking about pregnancy. But apart from that, everything else just kind of gets a bit lost.
You're very right, and we, because of course, I think most people now, and you know, because of all of the publicity around the adverse effects of smoking, we are more familiar with the adverse effects of smoking. But let me just get one step back. It was interesting while you're talking about marathon, and I was just something conjured up in my head. Pregnancy and having a baby grow in you and nourishing a pregnancy in your body is quite a feat. Those of us who are medics and we've learned the physiology of it, you know, your body goes through some significant amount of change. Yeah. And to do that, your human body needs to be in the best state of physical health. You're right, smoking is definitely injurious to your health, and stopping smoking is quite an important thing. But healthy weight is also quite important. Mm-hmm. Because overweight brings with it a lot of complications. Not only does it bring with it a lot of sort of unknown things that, you know, as a GP, Amna, you'd know, you know, yeah. People who are obese would probably have underlying hypertension, that high blood pressure that they've not been diagnosed with, underlying, you know, high blood sugar levels, not quite diabetic, but enough to really start to cause damage. Now, if you're overweight and you get into pregnancy and all of those things are discovered when you're pregnant, it's very, very difficult, because it becomes a very complicated pregnancy, because we still manage you. And we still have to work harder to get a safe baby and a safe mum at the end of that 9 months of pregnancy. But it's much safer if we understood those issues ahead of you getting pregnant. Yeah. And obesity and optimum body weight, it's quite complex. And knowing that, getting that support from your GP, getting that support from your other allied services, and we've got quite a few. We've got in Luton, we've got the Total Wellbeing Service. If you are known to have sort of borderline high blood sugar levels, you can go to the NHS Diabetes Prevention Program. there are community programs of weight loss. You can join your park run, which is
yes, park run. I feel like this is why I'm such an advocate for park run. I feel like whatever the show is that we're talking about, it always relates back to park run.
Park run. I mean, I'm a big fan of park run. Hey, and the thing is, I talked to the park run organizers and the organization. I've done some work with them, and I'm like, don't put the word run in there. Because, for a woman like me, I don't run. I kind of flop a little bit. I walk, but you still have me.
Okay,
and then you still encourage me to complete my 5K. So don't get put off by the kind of, oh my God, if I go to park run, I'll have to run. But all of those things, getting out into the fresh air on a Saturday morning or whenever it is that your local park run is running, with your community, engaging in that physical activity, even if it's that one day a week, it's amazing the things that it does to your body. And I think those are the things. Alcohol is another thing, because, we kind of think, yes, we're drinking in moderation. How much moderation is your moderation?
Yeah.
Okay. And many of our women are in corporate jobs these days, which means, quite demanding, social lives and other, home life that you need to balance. You're away from family, all of that taken into account. If you're thinking,
and then sleep. So
sleep
with that is then sleep. So all of these things are related. If you think about,
are you getting the kind of sleep, which sleep is so important, Amna? Thank you for bringing that up. Before starting the show, we were having this conversation. Our bodies are a balance of our mind and all of the physical thing that's happening around us. And to keep that optimum, there are quite a few things that just need to continue to happen. And that cyclical rhythm, once that's disrupted, it's quite difficult. So what we're trying to say, if you're planning a pregnancy, look at all of these things. Use the preconception tool. If you're diabetic, use the Diabetes UK tools. Get yourself informed. Get support from your GP. That way, when you're pregnant, you have tried your hardest. Now, nobody's saying, oh my God, are you now saying I have to get to my optimum weight and then only I can get pregnant? Nobody's saying that. All they're saying is be aware of your body. Try to get into a healthy state of body or mind. And then, of course, try your pregnancy. And then get pregnant.
I think what people kind of sometimes forget is that once you are pregnant, you don't know how your body is going to react, and whether it's your first pregnancy or your third pregnancy or your sixth pregnancy. Some people have a very easy first birth, and then they think, oh, well, my next pregnancy, I could do all of these things. Well, your body may react differently. I always tell people, you were never the age that you are now previously. So when you say, oh, I'm so tired now, well, now you already have a child that you're running around after. You're 1 year older. You may be pre-diabetic now. You've put on a little bit of weight. So actually everything inside you is very different in a way that it wasn't in your last pregnancy 2 years ago, maybe. And actually, when you're pregnant, that is a physical strain on yourself. Is that the best optimum time to be adding something new in? Probably not. You kind of want to be getting used to something. So I always kind of say to people, continue the kind of, if you were already walking, try and continue to walk. You may not be able to walk as much, but try and continue that. But if you were doing absolutely nothing before, and now you're pregnant, and now you're carrying a baby, and now all of these changes, and maybe you're being sick in the morning, and maybe all of these things, or maybe you're stressed about it, or any number of things, to then on top of that start a new physical activity, that's a bit much. And I think, we may be expecting too much from ourselves as women who are carrying babies, but also around you, for then everyone suddenly says, oh, well, you need to be healthy. You need to, make sure you're eating well and sleeping well and exercising. And Well, that's a lot of strain on, the person who's just found out that they're pregnant, isn't it?
You're absolutely right, Amna. And would you believe it? Across Bedfordshire, Luton and Milton Keynes, we want women to come forward and tell us as soon as they're pregnant, because our midwives are ready and there to receive them and give them advice. Guess how many women come and tell us that they're pregnant in those early stages by 10, 12 weeks?
How many?
Only about 50%.
Wow, by 10, 12 weeks.
So 10, 12 weeks is the earliest that we can get you all the support and test you all. But we only get 50% of our women tell us.
Wow.
That means the rest of the 50% are either probably not aware they're pregnant, I think, or don't know how to navigate. They think, oh, I don't know where to go, or I'm waiting for a GP appointment. Or people have said culturally, in some cultures, they don't want to declare pregnancies till about 12, 18 weeks. Now, we're trying to have those conversations because I know cultural issues are fine, but in certain cultural, in the diaspora, in Black African communities, there is sickle disease and stuff like that we need to know early. So we need to know it about 10, 12 weeks. But doesn't that show us that A, we are probably not ready? And when we are ready, we are still contemplating whether, how to go and get our service. So this preconception, healthy mothers, healthy pregnancy, let's start this dialogue. Let's start it early. Let's start it before we are pregnant so we can get our women in the right state of body and mind.
Perfect. And we will talk again about the event and how you can join us after the break.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome back to the Health and Fitness Show on Inspire FM. I'm Dr. Amna, and before the break we were talking to Dr. Sanhita Chakrabarti on our topic today about preconception healthy mothers. And we are advertising an event that is happening across Bedfordshire, Luton and Milton Keynes. This is a virtual event that is happening next Wednesday, the 28th, via MS Teams, and you'll find the links attached to all of the social media on this post, on this show today. And it's open to all women across the area to have a conversation with experts around being a healthy mother, a healthy pregnancy, and pre-planning, so pre-conception advice. And if you do have any questions, please do join the event next week. It's happening from 7 to 8:30 online. It's completely free. It's open to all women, and there will be experts there on the panel, which we've already kind of talked about, but we will talk again about other partners that are involved. But also it'll be an opportunity to ask your questions. Now, as always, we cannot give out any specific health advice. If there's anything very specific to you, if you're already pregnant and you have any questions or concerns, please, please, please do speak to your midwife, speak to your own GP. But for general preconception advice, please do either get in touch with us, or you can get in touch and join the event, or you can contact us and we will collate some questions to put forward in the event, and that's via the usual Inspire FM numbers, so 01582 481 822, or via text or WhatsApp on 0777 948 1822. So before the break, we were talking about the balance of kind of getting a healthy state of body, of mind, and making sure that you're putting yourself in the best possible position, really, to take on board something that is kind of physically demanding, mentally demanding, and will completely change your life, pregnancy, and how important it is to have those conversations.
Absolutely. So let me talk a little bit about what women or parents can expect if they're joining our event on the 28th of June. So we welcome anybody, everybody, particularly if you are from Black African Caribbean communities, if you are from Asian communities. We want to hear from you. We want to talk to you. We want to hear your experiences. The reason being is that the facts and figures and national reviews have shown that if you're from a Black African Caribbean community, the chances of a poor outcome in your pregnancy is 4 times more. If you're from an Asian community, it's 2 times more. Do we all know what the reasons are? We possibly don't. But one of the things that we've started to understand is if we get our women in healthy state and body and mind, what we've been discussing, ahead of them getting pregnant, particularly if you're from a Black African Caribbean country heritage, or you're from an Asian heritage, then we stand a better chance of getting you a better outcome.
Yeah.
On the 28th of June, we will have some experts on talking to us. One would be Amna Hawash, and she is the lead midwife from a national charity called Tommy's, who we are partnering with. And Amina does a lot of work, particularly in the communities. We talked about Black African, Caribbean and Asian communities, to understand some of the challenges, but also to support and advice and care. We will be talking about the Tommy's preconception tool. Again, Amna, I'll send you the link. It's freely available to anybody and everybody. It is in English, but we're putting some posters out in the community in different languages. But please use that. We will also be joined by our mental health team in Simran Kindar and Dr. Eleanor Baker-Glenn. And they are from our mental health services and are going to talk about why being in optimum mental health is very important before you get into pregnancies. And more importantly, in between pregnancies, how it's important to get support and advice to make sure that you're in optimum mental health. And so, that will be also the topic of discussion. The rest of the discussion would be very much around what support we are getting for communities and parents out there, and the advice to make sure that if you're not ready for pregnancy, to get the right contraception advice so that you can then stop and think and get ready for pregnancy. If you've got diabetes, hypertension, or epilepsy already, how to get advice from your GP so that you're on the right medication regime before you become pregnant. How eating healthy is so important, and where to get advice. The National Eat Well Guide gives you very good advice as to how to optimize your food and where to swap and how to eat the most nutritious food. I often hear from patients, but doctor, the advice is very geared to Western food and Western food cultures, and that's not what I normally eat. That doesn't comprise my daily bread, and that's fine, and that's absolutely fine, because what we have got now is quite readily culture-specific, healthy dietary advice, and we would be able to get that to you as well. Taking folic acid is extremely important, particularly when you've decided that you want to have pregnancy. Particular women who've got conditions like diabetes need to have double the amount of folic acid that normal women have. That's why it's important to have that advice with your GP so that your GP can prescribe that to you.
Yeah, because some people just say, oh, okay, well, someone gave me some leftover antenatal or prenatal vitamins and I'm taking that. But actually, do you know that is the correct dose for you, taking into account your medical problems? And this is why sometimes we get messages saying, oh, well, I want to ask this specific question on the show. Well, that's not always appropriate, because we can give generic advice. We can say, yes, take a multivitamin, eat healthy. But what does that mean for you? For the type of food that you want to be eating for your medical conditions, and that's important to have that conversation with your GP. And I would be more than happy to have that conversation with someone. We were talking before that actually a lot of women don't come in and talk about thinking about getting pregnant and what changes can be made. And I think that might be because there's a lot of information now available online if we're thinking about it, but also that might not be tailored exactly correctly to you, especially if you're from those high-risk communities.
And that's absolutely right, Amna. And your GP knows your health and your health conditions better than anybody else. So the generic information is for everybody else who probably doesn't have an underlying condition. But if you've got a very specific issue, then your GP would know how to best navigate and make sure that you get the right advice. The other important...
Also, sorry to interrupt you,
Yeah.
because you mentioned about mental health.
Yes.
And a lot of us, we know since COVID, have been struggling with our mental health, and also are a lot more aware that things can affect our mental health. And thinking about things like tablets for mental health, if you are already on tablets, having a discussion with your doctor, is it safe and correct to continue them? And for the most part, some of them are, but there are some that actually you may need to be switched to something else so that it's safe for you to have a safe and healthy pregnancy. And we won't know that as your GP. Maybe, you know, once a year we do an annual review of your medications, but in between that, a year is a long time. So I would kind of say, come and speak to us. Don't wait until we come to you and say, you know, you're on this tablet. Are you still on contraception? Any thoughts about getting pregnant? Well, no, if you're having any kind of even initial thoughts, come and have a chat so that you feel better as well, because I see a lot of people who have stopped their antidepressant, for example, and they say, oh, it's because, you know, I didn't want to be on it when I'm pregnant. I didn't know if it was safe. Well, actually, some of them are perfectly safe. And as we were saying before the break about getting yourself in the best physical state to take on a pregnancy, we also want to make sure that you're in the best emotional state and mental state to start a pregnancy, but also to continue through that pregnancy and beyond.
Absolutely, Amna, and you've got it spot on, because we see a lot of women who stop their medication or are continuing to take medication that probably could have been stopped. And your GP is your best person who can advise you on that. But also on the show on the 28th, we'll hear from other services who are also available to take your advice and support you, you know, if you're struggling to get into your GP. And the other thing I wanted to mention is that there's a lot of anxiety, isn't it, in the communities that you can't access your GPs and you can't book an appointment with your GP because of the pressures on the GP service. And you might be one thinking there, oh, but this is such a you know, there's other people who need the appointment more than me because, you know, really, you know, I'm contemplating on pregnancy. I'm not pregnant, and should I go and have this conversation? I would urge you to have the conversation.
Yes, the answer is yes, please come.
Yes, the conversation is as important as any other conversation that this GP wants to have with you. Our GPs are absolutely willing, with open doors, to have these conversations ahead. It's important to get these conversations with you ahead of you becoming pregnant, getting you into the right state of body and mind, getting you to be a healthy mother, to have a healthy pregnancy. And that is quite important for our GPs. So they're absolutely open doors. So please do not feel obliged that, oh, you know, it's such a lame conversation and I don't want to have it, because our GPs are willing to do that. Amna, before I kind of go on to other things, two other things that I need to absolutely also make sure that our communities out there know.
Yeah.
Very important to be protected from a couple of infectious diseases before you become pregnant. And those are measles, rubella, COVID, and flu in the flu season. Because believe you or not, many of us think, well, those are mild diseases. But if you're pregnant and if you get measles or rubella because you've not had the vaccination as a child, or you've missed out, or you're prone, then it could affect your pregnancy. We know of pregnancy deaths, babies lost, and also mums. COVID, we've lost mums, we've lost babies. Flu in the flu season also causes a lot of problems if mums get flu. Last winter, and every winter actually, we have a lot of poor outcomes in mums who are probably not vaccinated. Last winter, we lost a few babies as well. So it's important that vaccination is quite important.
And it's important that we still recognize, I think people are getting a little bit complacent about COVID, specifically flu, because COVID was such a huge kind of life-altering thing for all of us, of course, that actually flu has kind of, people think, oh, well, you know, flu is just a cold. Influenza is not just a cold. And, you know, I've been seeing lots of people, maybe not kind of just before the hay fever season, that got proper flu that felt, you know, I felt awful. And they say, but I tested for COVID and I didn't have COVID. So, you know, what could this be? This is flu. This is flu that we used to get, you know, pre-COVID, that used to put you in bed for 2 weeks. That was such a, you know, a huge strain on your body. And we need to remember that these things exist and are very dangerous.
And are very dangerous, particularly if you're a woman and you're carrying. So it's important to get those vaccines in, you know, ahead, of course, but of course in pregnancy, because, you know, flu is a seasonal vaccine. So we vaccinate in the winter. But as I said, I just wanted to emphasize that it's still a very dangerous disease. Although we kind of think, oh, we'll get a bit of flu, we'll stay in bed for 7 days and be fine. When you're pregnant, or if you're contemplating pregnancy, it's not. It's quite a dangerous thing. And the other things important, other couple of things that are important, of course, smoking, of course, alcohol, those are harmful, and I don't want to, and they're not any less important, particularly when you're contemplating pregnancy and your early pregnancy. The other thing important to remember is in some disorders, some genetic conditions run in specific diverse communities, such as sickle disease, thalassemia. And if unknown to you, it's important that we get to see you quite early in your pregnancy, by 10 weeks, because then we can screen and we can provide the right support. Because again, those conditions, if found late in pregnancy, or you become pregnant and you know about it, and we cannot get you the support early in pregnancy, causes quite a bit of a challenge. So yes, so as you can see, I've listed off about 10 things to think about before you actually can get pregnant. So or kind of think about whilst you're thinking about pregnancy. So none of us are saying, oh, you've got to get them all optimized and then only you can get pregnant. All we're saying is think about these things, get the right advice, and then contemplate pregnancy. So I think it's quite important that women understand. All of those will be discussed on the 28th of June, specifically for Black, African, Caribbean communities and families or parents or, interested people, and also from the Asian community. Why? As I just said, because it's 4 times high risk if you are from those communities, if you're Black, African, Caribbean, and 2 times high risk in pregnancy. And we want to absolutely make a dent on that and work with you to see how we can get you the support that you need early on.
Definitely. Thank you so much. And I think that, the comment that you made before the break, that 10% or only 50% of people, we know that they're pregnant by 10 weeks. So you're missing, a quarter of your pregnancy if your pregnancy progresses to 40 weeks, and we don't even know about it. So it's really, really important to join that conversation.
Particularly in Luton, we get women presenting at 20 weeks in pregnancy.
Ooh.
We get women presenting at 28 weeks in pregnancy.
Wow.
By that time, your baby is almost fully grown. And if then we find some things that we could have impacted on, it becomes more complicated to then work with you. We will still work with you to get the safe mom and baby outcome, but it becomes more complicated. So what we're urging women and parents out there who are contemplating pregnancy is to come forward, get the advice, get into the healthy state of body and mind, and then make sure that get your support as well early in pregnancy and book in by the first 10 weeks in pregnancy.
Yeah, thank you. Can I just check, will the event be just in English, or will there be any kind of interpreters or any resources that will be in different languages?
So we've looked into this. The issue is it's only an hour-and-a-half event.
Yeah.
And if we have to have different interpreters for different languages, we will run out of time quite quickly. It's in the evening. The reason it was chosen in the evening is that's the time people are back home from work, have fed the kids, and kind of are in a bit of a mind to absorb anything. Our clinicians are also kind of back home and can take in. The languages, we will have material that's available in different languages, but the actual conversation will be in English. We'll take that away and see if there's any way of converting the actual dialogue into different languages, and we'll put it back onto that link. If you see the flyer and if you go onto that MS Teams link, that MS Teams link will have all of the resources anyway. So if you've got access to that link, that is the resource suite anyway. We're putting everything on that same link as the year is progressing. So the material will be available in different languages, but unfortunately the conversation is going to be in English, because I speak Urdu and Bengali, but that alienates a whole lot of other kind of languages that Asian communities speak. I come from an Asian heritage. I am from India, but it's difficult to cater for them. But we are getting all of the material, the posters, the flyers, the information leaflets, converted into the 9 or 10 languages that are mostly spoken in Bedfordshire, Luton, Milton Keynes.
Excellent, thank you. Great. So I was going to pick up on one of the points that you made about kind of having the conversation, because obviously, please, everyone who's listening, please do join the event. It sounds very, very, very informative. I will definitely be joining and taking part in that conversation. If you're not able to join, Dr. Sanhita's just said where you can pick up on the different resources. But for anyone who's listening who is either a healthcare professional or just in any kind of caring role where you come into contact with anyone who may be contemplating pregnancy, what I would say is try and start having these conversations. So, and one learning point for me for kind of talking to Dr. Sanhita, but also kind of looking into this work, is that I will start being a lot more active in starting that conversation from my point of view as well. So while we're asking everyone listening, if you're having these thoughts, come and talk to us. Be also prepared that if you are a woman of childbearing age, that you may be asked the question back from your GP or from your healthcare professional, or from if you have a personal trainer and you're trying to work on your weight and being more healthy, whatever it is. Opening up those healthy conversations is really, really important, because we were talking about for me and for our communities, sometimes as soon as a woman maybe finishes university, and if you've gone to university at 18, you're done at kind of 22, 23, you start having maybe some unwelcome comments of when are you getting married, when are you having children, and it can sometimes, I know certainly for me, it felt like it was a massive block, because I was like, well, I'm not ready to have a child now. I don't want to get married straight away. I want to achieve lots of different things in my life. But actually what that meant was that I then never had kind of really those conversations. But also as a doctor, I don't want to make people feel that I'm saying, should you really be having children? Now, should you be considering that? But actually there is lots of evidence, and we know it's easier to it's possibly easier or possibly harder to get pregnant with increase in age or with increase in different medical conditions and all of these things, that actually we do need to have these conversations. And for me, that's a learning point for me to say, well, have you thought about it? And if not, maybe that would have been enough if somebody had kind of had that conversation with me, from that perspective, not from a kind of a you are now getting old, which I think we can sometimes take that as women as, well, I'm not getting old, I'm still young. But thinking, okay, where do I maybe want that to fit in my life, and what things do I need to pre-plan for it, either from a contraception point of view, as you said, from a medication point of view, taking vitamins, all of these things.
You're absolutely right. And one woman to another, Amna, and we were discussing our careers before the show started, isn't it? And we women, it's amazing where we've come up to, and I think we should celebrate every day.
Definitely.
Every second we are stepping into boundaries that maybe our mums or our grandmoms kind of paved the way for us to do, isn't it? My mum was a scientist. She always wanted to be a doctor, but she was told she could go and be a scientist, but she couldn't become a doctor, because that would mean going and spending a lot of time out of hours and being in classes with lots of men. I mean, this was the 60s. But she still excelled and she became a scientist. But what I'm trying to say is we are breaking boundaries all the time. Women are putting a lot of pressure on ourselves. But at the end of the day, being a mother is part of that. And we should think about it another step in our life, rather than putting a pressure amongst us. So, the pressure that you talked about, the moment you finish education, particularly in certain cultures, oh, when are you getting married? Or when are you going to have a baby? And the moment you get married, and then I was like, oh, when are you giving me a grandchild? And I think that culture will shift, because the more of us, our elders will start to realize that there is an optimum time for us to do everything. But that means there is a responsibility on us as women to be responsible for our bodies as well, and to understand those limitations, and to understand that our bodies are also not infinite. Medical technology can help us to an extent, but not to the greatest extent. And at the end of the day, our human bodies are physiologically at their best in our early 30s. And after that, it's just normal physiology. And they start to show the wear and tear. And however fit we could be, marathon runners, eating, healthily and doing all of that, it still will start to show an age. And therefore, although in lovely celebrity world, we see beautiful pregnancies, pregnancy bumps in celebrities for their 40s and their 50s. It's important for us normal women leading normal lives to know there are significant complications that we need to be aware of. So when we're getting to that stage in our life, and unfortunately for us in women, it all peaks at the same time. We are at the best stage in our kind of careers, in our lives. We are confident. We are absolutely where we want to be. We want to travel the world. But it's important for us, amongst all of that planning, is also think, when do we want to actually be part of a family and be a parent? And that is quite important for us to also think, which we sometimes ignore because we kind of think, we'll come to it. It'll come to me. Now is not the right time. But leaving it beyond and beyond only makes us more get into that realm of complications. So I think it's important, as we close today's show, to just reiterate, please come and join the conversation on the 28th. There'll be more throughout the year till April of next year. But the 28th, we're focusing on women, parents from diverse cultural heritage, Black, African, Caribbean, Asian. Come and talk to us how to get to a healthy state and body and mind, and what support we have got for you, how we can support you before you become parents and become healthy mums to have the healthy babies. Join us in this debate and this conversation on the 28th of June. And thank you.
Definitely. Thank you so much. So all the links will be linked to this post on the Facebook page, on Instagram, on Twitter, both through my link and through Inspire FM. So that's Wednesday, the 28th of June, 7 to 8:30. It will be on Microsoft Teams. You don't need to download a program or anything like that. There'll be a link that you can just click on and click join meeting. If you have Microsoft Teams already and you use it for work, you can log in the usual way, but it's completely free. Please talk to people, get people to join in this conversation, or contact us and we can pass on any conversations or any queries that you may have. Dr. Sanhita, thank you so much for joining us.
Can I just also say that the meeting will be recorded. Excellent. And the recording will be back on the thing, but we want everybody to join live because we want to have the live conversations as well.
Of course. Excellent. Thank you so much for your time. It's been really, really lovely to speak to you, and I hope to see as many of the listeners with us next Tuesday, the 28th of June, online at the event. Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at Inspire FM Luton.